Our bodies are our most cherished assets, especially for us women. Join me in this journey of learning, caring, and loving our bodies in Your Body to Bilano. Hi, Alida here, and welcome to another episode of Your Body to Bilano Body Confidence series that we're also calling YBTL. So today's episode is very personal to me. It's actually the inspiration for this whole body confidence series, because today's topic is something that I have struggled with from adolescence and into adulthood. And I know many of us have also struggled, or we're still facing that challenge. My guest today is a dermatologist, and she is going to take us through this journey of skin, particularly the skin on our face, and why it's so sensitive, and why it does not abide to the laws of the rest of the body, and why most of the times, especially for us women, it somehow, I would say, betrays us.
Most of the times.
All right, welcome Dr. Hawah. And today we are talking about the infamous acne.
Yeah.
The infamous acne, you guys.
Yeah.
So Dr. Hawah is a dermatologist in training.
Yeah.
I want Dr. Hawah to share her story because it's pretty interesting how she got into this area of dermatology. So yes.
Okay.
How did we get into this? As short as you can make it.
Right, I'm gonna try. When I was in fourth year, somewhere there, I struggled with a lot of dermatology related conditions.
Yeah.
That's acne, including eczema.
Yeah.
So it was very hard for me to actually find specialist care, and that's when I realized, it's very rare. And we only have 2 dermatologists in Malawi. So thinking about a common girl, like someone who wasn't even in medical training, to access such care was probably, going to be a hassle. And I was like, okay, maybe this is something I can actually do. And then later on in the course of my career, I realized even in research, we don't have enough dermatology or skin-related research. And then I think with now my interest of, having to do something I can actually see and combining it with research and everything, I was like, okay, maybe this is something I can actually do, because I think one of my hobbies is also to meet people and really just boost their confidence and get people looking good, really. So I was okay, maybe this is actually my passion and my career coming in together and making something amazing. So I was like, okay, maybe I can try and give it
a go.
Yeah.
Taking from that, I like the fact that it stems from passion and not just opportunity. It stems from passion, because indeed it is who you are. You like talking to people. I mean, the first time that we met, we talked for a whole 3 hours. That was just crazy.
Yeah.
But anyway, it's a story for another day. So what stood out for me when you were talking just a few seconds ago is the fact that we only have 2 dermatologists in the whole of Malawi.
Yes.
Why?
Well, I don't think I have the actual answer for that, but according to my observation, I think before it was, there is what we call conventional medicine. So most times, most doctors, when they finish, they want to do surgery, they want to do medicine, they want to do, all sorts of things. So I think the interest or the awareness about dermatology training hasn't been there much.
It hasn't been optimized.
Yes, and then also we do not have a lot of training institutions in dermatology. Like in Africa, I think we actually have one dermatology training center that is in Tanzania. There's a newly opened center in Kenya, and the rest in South Africa and probably some parts of West Africa. But mostly the issue is also the availability of training. It's not really much. And I think culturally, Africans, we haven't really been concerned about these things. So long as it's not hurting you, you're not really bothered about it. So the getting to concentrate focus on dermatology
the
health
itself,
is actually a recent thing.
I think maybe we undermine the need for a doctor who specializes in just the skin alone, because a lot of the times we think that, or we have this idea that, you know, cosmetics are good enough to solve the problem. So anyway, talking about the problem, let's talk about the problem at hand. So as women, especially as women, one of the challenges that we do have, and I've seen across the board for a lot of women now, is the rise in cases of adult acne, right? Because we do know that acne usually is something that we go through adolescence, under 25 years, and beyond that, that's when it becomes an issue of adult acne. So in your definition, as a doctor, from a medical perspective, what is acne?
Okay.
Is it poo-poo? Pimples?
Right. I'm going to try and make it simple, like use a layman language. So acne is basically, I think, a rash that one has to happen on the face. It can also happen on your chest, or let's say parts of your body that has a lot of fat. So it's usually the chest, the face, the chest, the upper back, sometimes the sides of the arms, and even your hips. So those parts that have fat pads are the ones that are going to be affected by your acne, and they're identified by the rash, which always usually starts from what we call a papule. So it's a rash that doesn't have, you know, anything inside. It's just like a swelling, and then it ends into forming a rash with pus inside, on top of it. We call them pustules. So, and then apart from that, you also have what we call comedons. So those are like the white hairs and the black heads. So that the rash is identified by those things. So
well, you know my skin journey as well, and how much research that I have done as well. What majority of the time, what causes acne?
Well, that's a really difficult topic to get by, because the word that is out there is the cause of acne is not really like identified the way you'd identify malaria, to say, oh, okay, you know, this is what causes acne.
And it's set in stone, Goody, that's that.
Yes, there are a lot of factors that that play a role in acne. So you have the genetics, so your genetic makeup. So it can be familial, like if your mom was predisposed or had acne prone skin, then the child can also have it. If their dad had an acne prone skin, you know, stuff like that. So it can be your genetics. It can be sometimes the environment that you're living in. If you're living in like a dry or humid place, it can be sometimes the food. It can be related to the food that you're taking. Sometimes, which is most common, could be the products that you're using. So the cosmetics. I think you mentioned earlier to say, oh, now it's become rampant and everything. So we've seen a rise in women trying to, you know, look good, trying to put makeup and everything. So that has also been a very big contributor to added acne. And then the other thing would be hormones, which is the most common one, especially in adolescents, people that are using certain medications, people that have certain hormonal conditions, they will have acne. And you also see some women who get acne when they're pregnant, some women who actually have their acne reducing when they're pregnant. Sometimes could be even medication. So the things that you're taking, the medication that you're taking, whether it is oral or something that you're applying, it can also lead you to acne. So change in seasons sometimes.
Interesting. I like the fact that you did mention the medication. For my acne, I know I have always had acne-prone skin from adolescence. But having lived in different places, I then discovered that, okay, the environment that I'm in also plays a huge role. And I think at a certain age, I think I was like 16 years old, my acne broke out. It was so bad. My mom decided to take me to a dermatologist, where then I discovered at a very young age that the food that I eat contributes to the reason why I was having so many breakouts beyond all my other peers. And so staying away from dairy, staying away from oily foods, deep fried foods, KFC and all those, you know. Not that they're not good, they're nice. It's just that sometimes when you're taking those in, it might affect your skin.
I think the factors that you've mentioned, and I like the first question that you asked me about acne and the factors that are actually related to it, because that's what actually makes acne difficult to understand and to manage. What causes acne in you might not be something that actually is influencing acne in another person. And what therapies actually work for you might not be
the same that
works in another person. It's just the dynamics are a bit difficult to trigger. So one, someone has to be pay attention to their skin, and yes, professional counseling is also very important. Because there are a lot of factors and a lot of things that are actually related to acne.
Oh wow. I like that you say that, because in my own journey, when I was dealing with this breakout, and I think I had told you that, you know, it was induced because of over medication in my body, which, you know, interfered with my hormones. Knowing that I already have a hormonal imbalance issue, it made the situation worse. So for me, I was adamant on not having more medication put in my system, of which I knew going to see the Dr. Hawahs and the dermatologist, it was going to add more medication into my system, but I didn't want that. I opted for natural remedies. This is not to say that you should do the same, but if your case is maybe similar and you know from a very, you know, from Kaligale that you have hormonal imbalance issues, then maybe you might also want to consider, you know, the natural remedies. But research is so important. So that's why I'd asked that, you know, what are the causes of acne? Because it means that the factors, if they're different, then that means there's also different solutions. For those causes. Exactly.
So that's why I mentioned to say, I think I'll just take you back a little bit when you asked me about why there are not many dermatologists in Malawi. I think the other reason could be because a lot of people think it's obvious. We know how to go about it, but it's more complex than it actually is.
Talking about solutions, I remember with my own experience, I would always get people coming to me and giving their suggestions. I think you should try this. I think you should try that.
There are always those people.
There's always. I think at some point I've probably also been one of them. Anyway, so I remember when I recently had my breakout 2 years ago, someone said to me to use Fanbact on my face.
Wow.
And at that time, I didn't know what Fanbact was. And so I remember going to the pharmacy, and because, you know, when you are at that point, you're sort of desperate for anything that will help clear your skin. Whatever solution comes forward, you jump at it. Exactly. So I went to the pharmacy and I said, I want Fanbact, and the pharmacist asked me, do you have a fungal infection? And I was like, what do you mean? I don't have a fungal infection. So he said, no, Fanbact is actually meant for fungal infections. And I was so puzzled as to why people are putting Fanbact on their faces. Malawi. Dilibize kuzola Fanbact on our faces. Why? I mean,
okay. So well, that happens a lot, and it's not just for acne actually, but actually people use it for lightening.
Oh, really?
So they're products like Fanbact, and then most creams actually that have we call them triple therapy. So they'll have antibiotic, they'll have an antifungal, and then they also have the steroid. So usually the steroid.
Do these things have like specific names?
I know
scientific names, or like in the ingredients section?
The ingredients are different. The most common component for the steroid part would be hydrocortisone or betamethasone, or yes, and then you have even more harmful products like hydroquinone. They'll be added there. Then the antibiotics can be anything. It can be clindamycin and all of that. Okay, so for example, Funbact, it's something that you actually get from the hospital when you have a certain, illness that needs either an antibiotic or an antifungal. So, I mean, for every medication, you're supposed to take it for a short while or for a given period of time. After that, you have to, dispose it off.
Yeah.
But if you're taking that
for a
long period of time, at first it's going to show you nice results.
Yes.
And then afterwards, you're going to start getting side effects of the product.
Oh, wow.
I don't know if you've seen around women that actually breach. Most of women that breach, even men that breach, they use those drugs that have those combinations. And then they're using it as a cosmetic product. So they're using it every day, for the daily use.
When in all essence, we're not supposed to be doing that. It's damaging the skin.
Exactly. So if someone used Funbact and they had some issue, it probably worked for them for a short period of time.
Yeah.
And then you would take it and then you use it for a prolonged period of time, and then you see that you get rebounds and even side effects of the medication. One of them being thinning of your skin and stuff like that. Yeah.
Oh, wow. So that means there's more that we need to be paying attention to in the products that we are buying.
Exactly. Especially like anything that has to do with medication, no matter how big we think it is, even amoxicillin, or it has to have a medical advice. Before you take it.
Oh, wow. That is scary, because now I'm thinking about it, how many people actually go ahead and advise their friends that no, you should try this, it's worked for me. In this case, for example, you've said that sometimes a doctor would recommend something for you.
Yes.
And then because it has worked for you, you will go and tell your friends that, this worked for me, the doctor, because the doctor said. So the word of encouragement here is to make sure that, okay, fine, that could have worked for someone else, but especially in a case where the acne is severe, then you definitely need to go to the doctor.
Yeah.
So knowing that we are limited on the skin specialist, like for example, if somebody today all of a sudden calls me and is like, listen, I don't know what is happening to my skin. It recently happened to a friend of mine who she's had flawless skin, and then all of a sudden she's had these huge pimples. And what are they called scientifically? I know that there's different names for the types of pimples or breakouts that come out.
Well, you have mild, you have severe, but then the lesions will probably have different names. And then you actually also have conditions that look like acne when they are not actually acne, depending on the definition that I gave you earlier. Yeah.
Okay.
So you have, which is a very common condition, especially in men, they'll have what we call rosacea. It also looks like acne, but it's not really acne as per definition.
So what is rosacea? In this case,
So a person will present with very severe rash and with a lot of pus in it. And they'll be big and with a lot of swelling around. Some of them will also have like deformation of the nose. It'll be reddened and also big.
Oh, wow.
Yeah.
It's funny that you say that. An issue like acne goes across the board.
Oh, it does.
And I think maybe we can just expound a little more on the men acne that you've just mentioned, that it's more prominent in men. I've seen quite a number of young boys, young men who struggle with this.
is the rosacea the only form of acne that usually appears in men that men are struggling
it's
with?
not really
or
a
what
form.
causes it?
Okay, rosacea is not really a form of acne.
Okay.
It's acne-like.
Oh, acne
Skin
like.
rash, yes, but it's not really acne. Acne will be, okay, so I think acne will be mild,
Yeah.
moderate, or severe. So the mild ones will, be one of those you just have to small rash around.
Yeah.
And then the moderate one will be when you have a little bit bigger, with a lot of pus in it and all of that. And then the severe one will be the one where you actually have cysts, so the big, acne. But again, that rash will have to be accompanied by what we call the whiteheads and the blackheads. Then that will be defined as acne. Yeah. Whereas for the rosacea, you have big sort of rashes with pustules, pus in it. Then they are called pustules. They'll be big and huge, but they will not be whiteheads and blackheads.
There will not be whiteheads and blackheads.
Yeah.
So for us to know that it's an acne situation, it's an acne
then
problem,
there'll be
we observe the whiteheads or the black.
Exactly.
Oh, wow.
Yeah.
That is interesting.
And then what the other also feature, it would be oily skin. Yeah.
Oh, wow. So as pro oily skin people, we are in trouble.
Oh, yes.
We are in trouble. And I also know that obviously people with enlarged pores, naturally enlarged pores, like I do have enlarged pores.
Yeah.
So that's for me how I knew that, I definitely am acne prone.
Yeah.
There's nothing much that I can do about it. But for the little that I can do about it, maybe we can go through maybe the different skin types, because usually when we're buying our products, we've got the combination, there's the oily, and then there's the dry skin, all right? With the oily, what I noticed is that most people with oily skin end up having the enlarged pores, but it's not everyone, all right? Some people have enlarged pores, but they have a dry skin or maybe combination skin. So in this case, what would you advise for people who are struggling with the oily skin, for example, and enlarged pores? What sort of solutions would you give to someone? Maybe on the skin care part of things, things to avoid, things to watch out for, etc.
There's no right answer for everybody. Skin care routines, skin care treatment is specific to that particular individual depending on their skin needs. So you can have oily skin, I can have oily skin, but definitely the remedies that work for you and me will be different. So much as you can have this, what can be assumed to be the same skin type, when you go to a doctor or a dermatologist, they do assess, okay, what issues do you have? So do you have oily skin? Are you also having scarring? Or are you having active lesions? Because I think one more thing that I forgot to mention, also have an impact or the issue of infections. So some acne can actually come because you've been infected, and when you present yourself to a doctor knows that this is definitely because of an infection. Yeah. So depending on the needs of your skin at that particular time, then a remedy can be formed. And the other thing also, if you, like for you, Elida, if a formula or a regimen is working for you right now, it doesn't mean that it will work forever. Especially if you're acne prone or if you have difficult skin. Depending on the changes that you go through, whether change of environment or change of weather, or change of generally your hormones, say you get pregnant and all of that, that can also, you also have to, to check and adjust on your regimen.
Exactly.
So the rule, I guess, in dermatology is pretty much, I would say, simple. If it's dry, you have to moisturize it.
Yes.
If it's wet, it has to be dried up. If it's oily, it has to be declogged to remove the oils. So basically that is, but then everything that is done on the skin has to be moderate and with a balance. Yeah. So you cannot say, oh, you have oily skin, then we're taking all your oils, because then you have a surge. It'll come. That's why everything becomes difficult.
Because then it's like, I remember during my research, it was an issue
Dr.
of,
Google.
it was the skin. For you to maintain good skin, you have to strike a balance. So like you have said, that for people who have dry skin, you're trying to keep it moisturized. For people who have oily skin, you are trying to declog without over drying the skin. Because what happens then is you're sending a message to the cells that, it's dry up here. Increase. And then so the oil produces 2 times more.
Exactly. So that's why, like, I was very careful with the question that you asked me, because if you say, oh, someone has an oily skin, if you go to a cosmetologist most of the times, or people that do not have proper training, they're going to tell you, oh, your skin is dry, then get this. Your skin is oily, then get this drying, or they'll give you some drying products. That can be in form of peeling agents, they can be in form of salicylic acid and stuff like that. It's good, but then that's when you see that it will only work maybe for a short while, and then later on you have a breakout again. Most of that is because there's no balance. So if you take your off, because even the oil is also important for the skin.
Also important
so
for
you
the
don't
skin,
have to take all of it out, because if you take all of it out, then you also need to moisturize at the end of the day. So there has to be a balance. That's why we need people that are actually trained to know what to do with what.
Exactly.
And the other thing, I think also, it's not only dermatologists that can actually give you solutions for your dermatology cosmetic issues. There are some people that do cosmetology. There's a course on cosmetology.
The people who are trained and qualified to deal with this.
So those people can also give you advice on things like that.
Oh wow, no, that's good. I appreciate the fact that coming from a doctor, you have actually said that it's not just dermatologists who can help you, but considering that they are cosmetologists, the skin therapists who have also been trained in that line. I think the only difference would be that cosmetologists probably are not in authority to
give medication,
to prescribe,
and then also generally the background where they come from is
it's not a medical.
So there are a lot of facets to dermatology. There's the cosmetology aspect, which is more to do with beauty and making sure that the skin is looking good. And then there are different other aspects, allergology, surgical. There is a lot of other.
You're dealing with
aspects.
Burns and things like that, so it's broader. Exactly.
So for a dermatologist, they probably have all this knowledge and the combination of all of that. So seeing a dermatologist will give you better juice, in terms of science and everything. But a cosmetologist will just give you about beauty and your skin, and so it's more basic. If you fail with a cosmetologist, then you can also see a dermatologist.
And I think I like that, because I think in Malawi at this point we probably have more access to cosmetologists than we do have dermatologists, the skin specialists. So I think in that sense, I think my only call would be that the cosmetologists who are out there operating in Malawi right now, that they're actually taking the right steps to their certification and being thorough in their consultation, so that when they do see a problem that when they do see a problem that is probably way beyond their expertise, they're more they're humble enough and honest enough with themselves to say, you know what, this situation, I think you need to see a dermatologist.
So those that can actually afford, because I'm well aware that the cosmetology services are a bit pricey.
Talking about the pricey, aren't dermatologists also pricey?
They are. They are.
Look at you taking shots at the cosmetologist.
Well, they are, but it's that part of dermatology is expensive. Dermatology generally is expensive.
Is expensive, yeah.
Yeah, but I'll take this I'll take an advantage for the here to bring awareness to people or the public out there that in terms in case you cannot afford the services, most public hospitals, I wouldn't say all of them, but most of them have dermatology clinical officers. So these are like clinical officers that were actually trained in dermatology. They are very trustworthy and very competent with that. So you can also just go and look at your district hospital and see if there is a dermatology clinician there, and then see if you can get some help. But there are those people in most of district hospitals.
So I actually like the fact that you have highlighted the dermatology clinical officers, because you know, it was frightening to me when I heard you say that there's only 2 dermatologists in the country. And I'm like, wait, hold up. How are these 2 people supposed to cater to us, the whole Malawi? So I like the fact that you've highlighted that these clinical officers who are able to help in that area, that they're also trained in that area. It's just they don't have the expertise is different. So at this point, if somebody calls me and says, oh, listen, this is the situation that I'm struggling with right now, where can I go?
I would say, depending on where they are, the best would be looking at going to their district hospital.
So the district hospitals in the country, despite the region?
Yes. And then looking, because I think the other challenge that we have is we have dermatology clinicians, but then because of the general health worker burden or imbalance that we have, you see these people now working in other departments trying to cover up on the shortages.
But the assurance is there that, you know, if you do go to your district hospital, then you are likely going to be able to get help in as far as...
Not absolute, but it's something that you have to... Yeah. Okay. I guess I'll get back to you to know which hospitals do you exactly have dermatology clinicians.
Please do.
At this point, I don't have the data.
So, for example, in the main cities, Queens, we have at Queens. At
KCH, yes, we have. In Zuzu Central, we have very competent young men and women that are always ready to help. Yeah.
Okay. All right. Cool. I think then that's okay, because I think it's at least it helps the few who can go and get their assistance there. I'm really glad that you are taking on this role, taking this journey, because we do need more dermatologists in the country, and not just the ones who are in the clinic, but the ones who are passionate like you and are able to, you know, take advantage of your own experience and show people that, listen, this is what I went through, and it's okay. It's not the end of the world, but there's various solutions that we can look into, because there's various causes of why your skin might be acting the way it is acting. No, thank you so much for coming.
You're welcome.
And that's the end of the episode for today. I could go on and on about this topic because it does not end. But what I will say is, if you are in a position where you're struggling with acne or eczema or any other skin-related issues, I think step number 1 is to seek consultation. Find your local clinic, your local hospital at the dermatology clinic, and see how they can help you. If you don't have that access, look for a cosmetologist who is qualified and certified, who will be able to assist you as well. Thank you so much for your attention for today's episode. See you next week. Don't forget to comment. Don't forget to like and subscribe and share with your friends, because, hey, somebody might just get the help that they need from watching this episode. So other than that, see you next time.